Designing flexible longitudinal regimens, supporting clinician planning for discontinuation of psychiatric drugs. Tapering antidepressants is increasingly recommended by clinical organizations. However, most providers lack clinical guidance on how to support it. We therefore examined how technology can support providers' taper planning with a lack of guidance. We developed design guidelines based on interviews with 8 providers who prescribe antidepressants. Drawing from the design guidelines, we developed AT Planner for assisting providers in planning tapers. AT Planner scaffolds the taper planning process by allowing providers to select from different options of available dosages for each drug and formulation with a visual interface. After setting the current and the next dosage, providers can choose the projection mode, duration of each interval, and goal dosage. Based on providers' input, AT Planner populates a tentative schedule projecting future prescriptions to scaffold taper planning. Providers can flexibly adjust the taper plans to fit their regimens by clicking on any interval in the table and change the type of medication, next dosage, projection mode, and length of intervals. When the changes are submitted, AT Planner repopulates the selected and the following rows with updated doses under the changed conditions. When providers select intervals that they'd like to prescribe, AT Planner creates notes for pharmacies and patient instructions. We evaluated provider perspectives on AT Planner in a study with 8 providers. Please see our paper for details on the benefits and concerns providers had on clinical support for tapering.